a professor at MIT. Recording. And since then, it's really gained traction. Peter Senge made the concept of systems thinking popular with his book, The Fifth Discipline. In this book, he defines systems thinking as a discipline for seeing wholes. It is a framework for seeing interrelationships rather than things, and for seeing patterns of change rather than static snapshots. So our traditional way of thinking is we often look at problems more linearly and don't take into account how one element of a system impacts the other elements. And systems thinking is an approach to problem solving that views problems as a part of a wider dynamic system. So it's a process of understanding how things influence one another as part of the whole. And also, if anyone has any questions at any point, you can just unmute your microphone and talk. It's kind of a perspective shift. Systems thinking switches from viewing just parts of a system to viewing the system as a whole. This means recognizing interconnections and relationships rather than singular objectives. And then also changing from structures to processes, which means that a complex system is more than a shape or a static configuration of components. It's essential to understand the self-generating and self-organizing process of such a system. So, and then also changing from measuring to mapping. So measuring, we're often, since systems thinking emphasizes relationships and processes, it means that our typical ways of measuring things aren't applicable to when we use systems thinking. So systems thinking is a useful approach to intervene in complex adaptive systems, which are systems that are intricately interconnected with many components. So basically any system composed of independent components working with one another can be defined as a complex system. And then just some benefits of using systems thinking. It assists in understanding relationships in a system, helps to see unattended and intended consequences of a potential change, which can help determine the best way to intervene in the system. It also provides a common mindset for people solving problems. If everyone is trying to solve problems with a systems thinking mindset, you'll have the same idea in the same way of looking at things, rather than trying to solve a problem in different ways. It also minimizes silo thinking. So instead of trying to solve problems the same way that you always have, you can look at ways beyond the normal established ways of doing things and can lead to better solutions, and also provide longer term solutions by looking at how a change in a system would impact other parts of the system, and then kind of implement that into your way of doing changes in the system. As Amir was saying at the beginning, my project was creating a systems thinking for health actions framework. And what we mean by health actions in this framework is really any intervention, initiative, policy, really anything that's being done within a health system. So there have been ever-growing calls to use systems thinking in health systems, as health systems are complex adaptive systems and have many changing components. Patients, caregivers, insurance, all of that are the components of health systems. So since this call for use of systems thinking in health systems, there's been a lot of theoretical uses of systems thinking. However, there's a gap in the theoretical use of systems thinking and that being translated into the actual application of systems thinking. So we wanted to create this framework as a way to make it easier to apply systems thinking in health systems prospectively, and then also review policies, initiatives, and see if systems thinking was implemented in health systems to kind of get a better track record, so that it's documented better when systems thinking is actually used. To do this, we developed this framework. So this is just an overview of what we did for the framework development. We first did a literature review, and from this literature review, we identified 6 systems thinking characteristics to be included in the framework. This was based off of Stavy and Hopper's taxonomy of systems thinking objective framework as well. And with this, we categorized all the systems thinking tools and methods that were found in the papers from the literature review into these 6 systems thinking characteristics. And then from there, we presented the framework to several different workshops where we gained feedback from expert systems thinkers. And after that, we made the changes from the expert input. And then we tested the applicability of the framework by using it to determine if systems thinking characteristics were used in the COVID-19 response in Pakistan. And I'll discuss how we did that and the results of that later in the presentation. So this is the image that we came up with to kind of represent the overall framework. It's an iceberg model because we wanted to represent how it allows a perspective shift from the health system performance here at the top to the actions in how the underlying structures, patterns, and behaviors of the systems can be kind of underneath the water. The systems thinking characteristics aren't meant to be considered in order. Rather, the different varying depths of them represent the levels of technical complexity required to apply them. So going over the different characteristics. So on the left-hand side here, the most basic systems thinking characteristic is recognizing and understanding interconnections in system structure. This just means that health systems are composed of different interconnected parts, and understanding how these interconnections work. This helps gain an insight of the key actors within a health system, as well as the overall system structure. And then here on the right, we have identifying and understanding feedback in the system. Feedback is the cause and effect relationships that occur among the different elements in a system. It's crucial to identify these, both positive and negative, that occur among the parts of the health system to recognize the feedback loops and determining chains of causality within a system to really understand how the system flows. Then here on the left, we have identifying leverage points. These are areas where small changes can have the biggest impact. Identifying leverage points can help you identify where to intervene within a system. And many times health systems have scarce resources, so identifying leverage points can help you identify where to use these resources in the most efficient of ways and have the most substantial improvements in the health system. And then here on the right, we have understanding dynamic behavior. Recognizing dynamic behavior can help determine the effect that behaviors from components of a health system have on the entire system. And then again, on the left, we have using models to suggest possible solutions to a problem. This refers to using visualizations to display causality, feedback loops, and variables to achieve the purpose of a health system. The visualized models don't depict an actual real-world system. Rather, it is more of a simulation of how this would happen and the results of what would actually happen if this model were real. And then finally, we have the most complex systems thinking characteristic in our framework, and that's creating simulation models for testing policies. Using simulation models helps translate multifaceted scientific findings into easy to understand outcomes. So this is just a brief overview of all of the 6 characteristics that we included in this systems thinking for health actions framework. But to translate this into something that can actually be used and applied, we created it into a checklist. So this is the basic view of the checklist. This is just the first systems thinking characteristic that was included, just so you can get kind of an idea of how we transformed it. So the checklist was created as a guide to provoke ideas of how to apply a systems thinking approach. Here on the left-hand side, you can see the checklist items, and then on the right-hand side, you can see the relevant systems thinking tools that might help you include the checklist item characteristic into your health action. So checklist is kind of not really fully correct term. It's not meant to have everything completely checked off for this. Rather, as I said, it's a guide. So maybe you only do recognize the need for stakeholder involvement. And with that, maybe you fully included this systems thinking characteristic into your health action. So you don't need, it's not meant to do all of the things that are on the checklist. It's more just as a guide to say, oh, have you thought about this yet? Or have you done this? And that was our goal for doing this. This checklist was then applied to the COVID-19 response in Pakistan, as I was mentioning before. It was applied to the COVID-19 National Action Plan, and also interviews that were conducted as parts of a bigger initiative that our team was part of, the Systems Thinking for Strengthening District Health Systems Initiative, which took place in 3 countries, but for here we just focused on Pakistan. And to do this, a thematic deductive approach was used. So that just means that we use this previously created framework, and from that we created a code book. And then we went through the text, and if the text fit any of the characteristics, we would add it to that section. And so a few examples of the results that we found from doing this to the transcripts from the interviews and also the COVID-19 action plan were we found under the recognizing and understanding interconnections and system structure, we found that the National Action Plan identified the system structure by listing the key stakeholders and sectors involved. Actually, for this, it's the most basic systems thinking characteristic that we included, and it was identified in all 3 of the interviews and also the National Action Plan. And then in the interviews, the respondents identified the use of process mapping in the district, which assisted in identifying the stakeholders involved in the system. I didn't include all of the results here, so it's just some ones that were picked out just to kind of show you how we use the framework to identify the texts that fit these areas. So then with identifying and understanding feedback, we found that the National Action Plan had a monitoring and evaluation plan to use the feedback to influence changes made in the system. And then also in the interview, respondent 3 explained how process mapping helped to understand the feedback loops that exist among the different stakeholders in the system. The National Action Plan identified the leverage points. They actually identified 19 key areas where the COVID-19 policies could have the most impact on minimizing the spread of the virus. And then finally, understanding dynamic behavior. The National Action Plan predicted how their preventative policies in the first phase, and then the containment policies in the second phase would impact how the virus would affect their health system. So those are the 4 systems thinking characteristics that we identified in the interview transcripts as well as the COVID-19 action plan. So we found 4 out of the 6 were identified. and we concluded that due to the time-sensitive nature of the pandemic, it might not have been very smart, or they might not have had enough time to do the more complex systems thinking characteristics, as those can take more time, and when you need to act quickly and there's a virus that's spreading, it might not be in the best interest to take more time. But we did find the 4 systems thinking characteristics. So overall, the checklist was able to identify several pretty well the systems thinking characteristics, and we were pretty happy with how we were able to use the checklist. However, we would still like to further develop the checklist. We only use the checklist on retrospective policies and in interviews. We would still like to validate it on prospective health actions. So this would be like creating an intervention or creating a policy and seeing how it would do by applying the checklist before a health action is taking place. We would also like to make the use of the checklist in the framework a bit easier. This would probably be with developing a software where it would be more user-friendly and more applicable for everyone to use the checklist, as the checklist was only used on people that have already had previous knowledge of it. And then also we created a systems thinking toolkit. This is just to help, I'll open the link and reshare my screen. 1 second. So the systems thinking toolkit is just for people that are interested in using systems thinking but don't know where to start. So we have our iceberg model here, and if you want to identify leverage points in your health action, you can click on that, and then it will take you to the different systems thinking tools and a description of them, and then resources that you can find of how to implement them. This is just like, very helpful for systems thinking tools and an introduction on how to use systems thinking. But again, we hope to really make the checklist in the framework more applicable in the future. So that is a quick introduction into what we've been working on here and systems thinking in general. So thank you for your time and for joining, and I'm happy to answer any questions.
Thank you so much, Jenna, for the very interesting presentation. And before we open up the floor to the audience to share their questions, and also I see that we have questions in the chat box. Would you like to share with us, Jenna, given that we are all starting our career, how you came across actually system thinking, and how was like the beginning of your journey? If that would be interesting to you, for you to share.
Yes, so I was doing my master's at the Swiss Tropical and Public Health Institute, and my team here is very involved in systems thinking. So I got involved with the systems thinking for strengthening district health systems project that I briefly mentioned before. In this looked at district health systems in Botswana, Timor-Leste, and Pakistan, and gave them tools and workshops and such to learn more about systems thinking, and helped them apply systems thinking in their different health system challenge. So the reason we focused on Pakistan is they each country and district chose a different health challenge. Pakistan chose, in one of their districts, they chose COVID-19 case or something around there. So it was, but anyways, with systems thinking. So we got involved that way, and I was just intrigued with it, and was involved in that project. And then from that project, we kind of realized still the gap in systems thinking application and the theory of it. So we wanted to try and bridge that gap somehow. And this is what we came up with, was creating a framework.
Amazing. Many thanks for sharing. And now we can actually open up the floor for the audience. Would anyone be interested to ask question, or maybe the person who wrote in the chat would like to ask the question? Chiara, would you like to start? If I pronounce your name correctly.
Yes, hi, it's Chiara. Thank you for the presentation. It was very, very interesting. I was wondering something regarding the checklist. So you describe it as a flexible tool. So I was wondering, when we are working on a project and we want to use a system thinking approach, which would be the requirements to still call that approach system thinking? Because, for instance, if someone would just do a stakeholder analysis, could we still call it system thinking?
Yeah, thanks for the question. So this is something that we ran into a lot while creating this and doing this. To say that you're doing a systems thinking approach, there's no like scale or anything that tells you like you're doing a systems thinking approach or you're not. There's no like, yeah, so you could use one thing and say you're doing a systems thinking approach. There's really no like rules or limits to do this. We discussed this when making the framework, saying like, oh, you're doing a higher level of systems thinking or a lower level of systems thinking, but then we couldn't come up with a way to define what level of systems thinking you're doing, because maybe you're only doing like the first two characteristics of systems thinking that on our thing, but maybe you're really implementing them, but then you could be doing another later systems thinking characteristic that's more complex, but it could just be like a really small part of your health action. So this was also something that we had a difficult time coming up with, because there aren't really any set standards for that. So I don't really have a good answer for you, but it's also something that we thought of and would be interesting to maybe further define in the future.
Okay, thank you for the answer.
Thanks a lot, Chiara, for the question, and Jenna for the answer. And we have a question for from Sylvia. Is Sylvia here? Would like to take the question directly to Jenna, or maybe I can, if you can see the question now, Jenna. She's asking, and she's wondering if she can apply system thinking. Yes, you're here, please. The floor is yours.
Yeah,
I'd love to listen to you. Yes, welcome.
Thank you very much, Jenna, for the interesting presentation. I'm wondering if you can apply system thinking even on the impact, let's say, of innovation management in a certain hospital, starting from the micro and contextualizing it. Is it possible to use system thinking in this way, starting from the bottom and not from the top?
Yeah, so the idea with systems thinking is that it can be applied anywhere. Actually, in the STDHS initiative that I was talking about in the 3 countries, we were applying it at the district health system level. So it was starting more at the bottom. However, we did find that some things were difficult to change without kind of involving higher up levels. But I don't think that you should rule it out. I think that it can be applied to any in any way, and really just like systems thinking in general is just using a more holistic approach. And yeah, so I think it would be possible, but sometimes it's difficult to change policies and initiatives if you're not involving the higher up levels as well.
There are several loops involved, but yeah, it may be interesting. Thank you very much.
Yes, thanks for the question.
Thank you.
Are there any more questions? Please feel free to raise your virtual hand. Yes, Kathy, please, the floor is yours.
Hi, yeah, I was wondering if there were any concerns throughout the design process about using a checklist to frame the approach for the framework, as that's traditionally a bit more of a linear tool.
Yes, thanks for the question. Yes, this was also something we discussed, and that's why we tried to frame it more as a guide, but like a list still. But yes, it was a big topic of discussion because yes, checklists, you kind of see like you have to check off everything and you're just trying to get this stuff done and not really looking further than that. But we decided to keep it as is. But I think the idea in the future would be to translate this into more of a maybe like question based, like have you done this, and if so, how, and if not, like how can you? So kind of maybe steering away from the checklist a bit more, because yeah, the checklist can be a bit linear and not as user-friendly as maybe something differently. So yes, thanks for the question.
Thank you.
Okay,
Yes,
I
yes,
guess
Claudia,
I'll go next. And I was wondering, I mean, systems thinking is a discipline that's somehow an approach that has been applied to several fields over time. It has been applied in business science, in engineering, in urban studies. What has made it so late for health system and for health actions in general to develop this kind of interest in systems thinking, in your opinion, and based on what you've seen so far? Thank you.
Yes. So based on what we found in the literature, a lot of the explanations for this were systems thinking is often seen as time consuming and also costly. So a lot of times health systems don't have a lot of extra money to do this. Although it's not always true that systems thinking costs money, but it's just conceptualize that it costs money. And then also time consuming. Sometimes you have to make really quick decisions and you don't have time to create a process map or do this or that. So I think those are the two that I would say I've come across the most while looking at the literature.
yes, thanks, Claudia and Jenna. Kira, please.
Yes, I was also wondering about something else, because during your presentation, you mostly talked about how the system thinking approach is applied to interventions. So how do you see it actually applied in research when, for instance, we are trying to understand the different causes and effects of a health challenge?
Yeah, I think it could be applied with the same kind of way. Just kind of what do you want to do in your research? What is the goal, and what exactly are you trying to get to? Like, where do you want to implement systems thinking? So I think when you do it prospectively, it's kind of more based on what elements of systems thinking you want to use. I would think so. Like if you want to, like, what research in particular would it be like implemented in, or would it be prospectively or retrospectively? And just kind of going from there, because for us, we implemented it retrospectively, and our goal was to see if systems thinking characteristics were implemented, to kind of see if systems thinking was being implemented without us knowing, and then to create better documentation of that. So I think when you like ask yourself those questions and then go and see which characteristic you would like to really specifically look at, I think you could use the same kind of methods. But as I said, this was just kind of a base line to try and do it, but there's still a lot more developing that would need to be done, and maybe verifying it more in that situation would also help develop the checklist and framework further.
Thank you. Wissal?
Hi, sorry. I was quite interested in the example that she gave out of Pakistan, where you specifically said that there were just a few of the characteristics that were being used for the systems thinking. So that kind of brought my question in, is there a limit or a standard of how many elements can be thought of or being part of the systems thinking where it's no longer system thinking? Because there are some contexts where the health system may be broken due to humanitarian or conflicts and maybe even natural disasters. So I'm more interested in the most minimalistic standards for this type of health systems thinking.
There's no really standard of how to the level of systems thinking that you can apply. I think just the idea of systems thinking is to try and look at things more holistically and look at problems and things in a more holistic way. I haven't been able to find any standard or anything like this that says like you're doing systems thinking or you're not doing systems thinking. I think it could be done more in the future, but there's no level of systems thinking. There's people that have like done different complexities of systems thinking, and this is more complex than this, but there aren't like levels saying, oh, you for sure did systems thinking or you didn't.
Okay, thanks.
Thanks, Wissal, and thanks, Jenna, again. Any other questions from the audience? Okay, and please, we are going ahead with our agenda, but if you have any questions, don't hesitate to just drop it in the chat box below, and Jenna will be happy to take it and answer it. So now I'm giving the floor to Claudia.
Thank you, Abir, and thanks everyone. Actually, before starting, I wanted to give a snapshot on what the future might look like within this group of people interested in systems thinking that we are trying to establish within the SYSTAC Europe hub. So I would like to probably give the floor to Rachel first. I saw she was with us, because she will be our next guest speaker, introducing one of the methodologies of systems thinking that are being applied to health systems. So if you're with us, Rachel, I will leave you the floor.
Sure, no problem. Can you all see my screen, the PowerPoint? Oops.
Yeah.
Perfect. Great. Hi everyone, great to be here. My apologies for being late. But in terms of what's coming, we're hoping to also run a webinar that's looking at CLD approaches for health systems research. Jenna, did you touch on CLDs a little bit in your presentation? No, cool. No problem. So causal loop diagrams are a method for systems thinking that are used in different fields. And essentially, I won't take up too much time talking about them now, but essentially they give us an idea about what drives problematic behavior in the health system, which leads to identification of bottlenecks, what actions we can implement to improve health system behavior. They're really cool and useful tools. So the team were thinking that we might run a seminar or a webinar talking about causal loop diagrams. We're still having a discussion about what this might look like, but we thought what might be useful is discussing what is a causal loop diagram, what kind of research can we answer with CLDs, and what research is not appropriate for a CLD approach also. How we might go about designing a study that uses a causal loop diagram approach. I imagine that might be quite helpful for participants. And also a practical example of application with reflections on application. So what went well, what we would potentially do differently next time. So yes, we thought that might be interesting and useful for participants. So coming soon.
Thank you, Rachel, and very much looking forward to this. So now just to brainstorm a little bit with all of you. So we're just at the beginning of establishing this platform, as we were saying, and we would like to make it as much as possible something that reflects actually the aspirations, the interests, and the perspective of everyone. So I would start actually with a small game. We've been questioning ourselves whether the branding, the name SYSTAC Academy was the right thing, because as we've been saying so far, we want actually to bring systems thinking out of the academia. We want to bring it to hospitals, as Silvia was mentioning. We want to bring it to practice. We want to bring it to policymakers so that we can actually make a change. So I will post here the link, and I will share my screen so that you can also connect with the QR code, and we'll give a bit of time to all of you to just brainstorm on what would you like this forum to be. If you could choose a name, if you could choose the main focus, if you could choose what this is all about, which words come to your mind, because this is what then is going to probably inform the future and the developments that we will try to propose to you. We'll just leave this screen on and the link in the chat box for some more time. Please, 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 as many inputs and ideas as possible, because it's really, we don't want to offer any solution because we don't have a solution. We're all beginners. We're all very interested in making this mind shift towards systems thinking. And we can rely actually on very experienced systems thinker, and some of them are with us today. Well, Jenna and the whole Swiss TPH team, Carmen, Anna, Del from Lund University, also associated the Karolinska. So all these people have been supporting us tremendously so far in defining the objectives. But I would really then want to make this shift and think about you all. So let's see. I see some of these words are coming. I'll just probably share my screen again so that you can see. Okay, yeah, there's already a lot of input about awareness, about connection, about complexity, about applicability, about collaboration, understanding, analysis, strategy, and so on and so forth. So please keep providing inputs, because this is gonna then help us define the future strategy. So you've touched upon some of the key objectives that we've also mentioned in the presentation. Of course, activities can be many. Webinars are the first that come to anyone's mind whenever we talk about learning, but then there's much more to that. So also in terms of activities, we wanted to have a bit of a collaborative session with all of you, this time on a different platform. So if everyone could click on the link that I've just posted in the chat box. This will give you access through your email to a mirror page that I will share with you while we talk. So here we've organized a bit the activity based on the key objectives that we've brainstormed among the 5 of us together with the SYSTAC Europe coordination team. About the future of this platform. So we want to promote and create awareness about systems thinking, of course. We want to establish potential collaborations among researchers or between researchers and practitioners, so that researchers can help practitioners in finding solutions, and we can solve together the complexity that we observe in health systems. It's about learning. So how do we practically learn to apply systems thinking together. From whom can we learn? Probably we're having some experiences that might benefit others who are interested in applying the same methodologies elsewhere. It's also about possibilities of future mentorship, for example, or career orientation or career development, career shift. So within each of these broad topics that we have identified and that somehow reflect also what you were mentioning in the initial brainstorm, what are some of the activities that you would like or that would benefit you? So feel free to, if you're familiar with Miro, feel free to use it. If it's the first time, you just pick a sticky note and you put it underneath the column of the big topic. So for example, what would you like us to organize in terms of learning? Which are the key topics on systems thinking on which you would like to dig deeper? In terms of mentorship, are you interested more in peer support groups? Are you interested more in having a buddy? Are you more interested maybe in having a senior mentor because you already have some basic knowledge and you need some more refined techniques? So just feel free to suggest ideas, and while this screen will be populated, please also feel free to open your microphone and suggest something. What would be your priority? Because this is really, as Abir was saying in the beginning, it's all about you and us together. And there's Asma, please.
Hello, can you hear me well?
Yes, very well.
Okay. What I'm interested, since you are asking, I really would love to be with the group that I'm working in a system thinking. No, it's a approach for my problem. I wanted to use a system thinking. So at the same time, I wanted the people who are interested is not in the result, in the approach itself that I use. So I can have a group, even if we are sharing the authorship or whatever about the process. So I have a team who can help me, and we help each other, the seniors, even juniors together, like a second mind together, second mind with me during I'm thinking to write this paper about the approach I used. So this is what I am thinking when I get into this hub. When I see the hub, this is what the first thought I get. Like I wanted this like a peer support or publication, second mind, these things. Thank you.
And that's exactly spot on, and it's a bit what we would like to establish and to create a space where someone that is working on a topic can reach out and say, hey, I'm working on this. Anyone is interested in collaborating or anyone is experiencing this, so that people can start really working together, trying to learn together how to use these approaches. And then if they get stuck, there is a second level to which they can potentially escalate any key methodological question that they might have to a senior mentor, which is the whole SYSTAC Europe hub, where there are big universities with people that are very well experienced in these methodologies that can potentially support if we get stuck somehow at our level. So that is definitely an opportunity. I've posted in the chat box the link to the membership form. So this is a link that we ask all of you to fill if you're interested in getting new information. So we will share not daily messages. Don't worry, you won't be spammed by us. You will even wonder whether we exist, because we really try to limit the amount of information to the bare minimum. But of course, once you're part of the mailing list, if you want to reach out to us and to ask for specific information, or you want to ask already for a specific support on a key topic, feel free to drop the message in the Google group, and then someone who can answer will answer to you, or one of the 5 of us within, let's say, the volunteering team that is putting this all together will refer you to the most appropriate person. I see there's a lot of movement on the screen, and thank you for all these suggestions.
Yes, thank you so much. It seems very interactive, Claudia.
Yeah, ideas are dropping in, and it's all really about practical examples of application. And this is coming. The webinar we're planning with Dr. Cassidy is exactly about this, to provide us a beautiful example on how causal loop diagram can help modifying policies or actions in healthcare. Writing papers together, this is definitely something that all of us would be interested in. Exchange of ideas, journal clubs, as Abir was mentioning. So really, all of this, it's about you and us. So once you will probably subscribe or not to the mailing list. If you do not subscribe, don't worry. There will be a dedicated page at a certain point within the website of the SYSTAC Europe Forum, and we will keep posting. So follow any of us on LinkedIn. You will get updates on the next steps. But if there's something that for you is really of utmost importance, or something critical that you would like us to prioritize in the near future, feel free to make this suggestion, or this is intended as a space to discuss and to make this platform whatever is more of interest for you, because we don't want it to be yet another mailing list that no one eventually will read, because we all know we are all part of those, and we want to make something different. I don't know if anyone else from the Swiss TPH or from SYSTAC Europe, Del or Carmen, Anna, if any of you would like to add something, as you're the ones with more experience on this matter.
Nothing particular to add on my side, just to thinking, I mean, it's great to see you all here. And I think, as Claudia and the others are mentioning, I mean, we're here if you need us. We're sort of in the background to what you guys are doing, but we are happy to jump in and give support as we can, or if you have any questions, and you know, those can come to us as well moving forward. And if you want to think about SYSTAC Europe as well, I'm sure there's more information on that you can get from the group here.
Yeah, maybe also just from my side, big congrats. It was a really interesting, engaging session. I already wrote it in the chat, but Jenna, fantastic presentation, and thanks all for being so active. I think for a first event, this definitely, at least my expectations, it really exceeded them. So yeah, big congrats, and I'm just so excited to join and look forward to the next sessions and to learn with and from all of you. So thanks.
Thank you so much, everyone. Del, Carmen, and the rest of Swiss TPH group. Thank you for the support. Thanks, everyone, for joining, and many, many thanks to you, Jenna, for the wonderful presentation. It was a great start and kick-off, start for all of us, hopefully, to include and hopefully incorporate system thinking in our methodologies and our research. And we're really looking forward to seeing many of you in our upcoming events. And we hope that by now you have already subscribed to our mailing list, as Claudia mentioned. And yes, have a wonderful day. Thank you, everyone. Bye.